big picture, long-term impact of COVID on the healthcare system slash the hospital system? Please, Bob.
Yeah, so the long-term impact on hospitals and health systems from COVID is really significant, starting from the financial impact. And we're going on 2 years. March 4th, 2020 was our first COVID patient. And in year one, 40% of hospitals across the U.S. were operating in the red because of loss of revenue or additional expenses related to COVID. The 21 experience wasn't much different. And as we got into 22 with the Omicron surge, we're seeing, some significant financial impact. So certainly, I think hospitals and health systems are going to have to reinvent themselves, reimagine themselves as they come out of this pandemic and think about what's going to work and what's not. A couple other trends that, I think will emerge from this pandemic. One is technology and specifically telehealth. We saw it surge during the first part of the pandemic. I think when the lockdown occurred, about 80% of all health visits were being done through telehealth and telemedicine. That did drop significantly when folks started to come out and started going back to their doctors in person, started using hospital emergency departments again. But I think overall, we're probably going to see a steady rate of probably about 30%, 20 to 30% of all visits will be done through telehealth. The third trend, I think, that is really apparent from COVID is the impact that the pandemic has had on mental health, mental illness, behavioral health. So I think there's going to have to be, from the hospital perspective, from the health system perspective, a real focus on behavioral health issues going forward. There's been a stigma for years and years. Some hospitals and health systems have tried to face this challenge head on. Others haven't. I think there'll be no choice going forward.
I'm Miles, and this is what I work for. To be my best for them and for me, in body and in mind. I need a health insurer that helps me get the care I need for both. That has mental health professionals that I can talk to when I need to. Because when I feel strong and secure, so do they. This is my life. And this is how Horizon Blue Cross Blue Shield of New Jersey works for me.
Also brought to you by Horizon Blue Cross Blue Shield of New Jersey. Here when you need us most, now and always. Johnson & Johnson, the Fidelco Group, Investors Bank, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, the Port Authority of New York and New Jersey, moving the region through air, land, rail, and sea. The Northward Center. And by the Robert Wood Johnson Foundation.